Welcome to the most authoritative hour on TV. It's The Pulse. And we're live from our studios in Kokomlimli on your digital terrestrial TV because we're free to air on DSTV channel 421 and Go TV channel 144. Remember, we're a home of independent, fearless, and credible journalism. This afternoon, Ghana Registered Nurses and Midwives Association is asking government to, as a matter of urgency, halt the reintroduction of the community health workers. We will hear from the association as an MOU signed between the association and the Youth Employment Agency for the reintroduction of the modular 6-month training of community health workers becomes contentious. Also this afternoon, looming labor unrest. More chaos is expected on the labor front as various worker groups threaten strike over salary disparities and what they describe as unfair conditions of service. We'll speak live with the Deputy Employment Minister. Plus also on Pulse, calls for Health Minister to be sacked intensified as private legal practitioners rally support from members of the general public to petition Parliament for the Minister Meno to be tried by the House for perjury. We have all the details this afternoon as the committee demands an amount of 16 million Ghana cedis be paid, which was paid to middleman Al Maktoum, be retrieved. My name is Aisha Ibrahim. The Pulse is brought to you by Global Communities, Dignilu, Affordable Safe Sanitation. Remember, we're also streaming live on YouTube and Facebook on all our social media handles. Tweet at us with the hashtag The Pulse. My personal handle is @Nana Aisha. I am super excited to host you. Let's begin this afternoon with private legal practitioner Martin Kpebu, who is rallying support from members of the general public to petition Parliament for Health Minister Meno to be tried by the House for perjury. It comes as a parliamentary committee that probed the Sputnik V vaccine deal revealed government paid Dubai-based businessman Sheikh Al Maktoum more than 16 million cedis for the vaccines, despite claims by the health minister under oath during the public hearing that no money had been paid. There have been calls for the minister to be sacked after the report was made public. A motion by the minority to have the minister censored was deferred by the speaker just before the House rose. But speaking on Newsfile, Martin Kpebu says the minister should have gone a long time ago.
Mr. Menu is now embarrassing us as a country. It's as if he's our best talent for that job. But we all know he's not. You see, that's why maybe it appears he doesn't understand public service. Look, there are 1,001 citizens who can perform that job. The president chose him, but he has taken us down a path that has embarrassed us so much. So he just has to go quietly. But you see that he's digging in his heels. And then you have some of our citizens holding press conferences to support him. It cannot be supported. Let's come to this. Samson, you see, the last time we raised this, we mentioned that, look, money must have been paid because even the agreement for the procurement of the vaccine, clause 4.2, itself says that we're to pay for the vaccine with a site LC. Samson, it says site LC.
Right.
From the little understanding, this site LC means when the goods have been delivered, sometimes even not delivered, it's possible for the person to be paid. That's the exporter, the person who supplied, depending on how the contract is worded. But bottom line is that whether the contractor or the exporter should be paid because the goods have left the country of export, or even in Ghana, once you say site LC, it has certain meanings, okay, that certain documents will be presented. So the argument I'm making is that even without this payment that has first come out, the contract that he signed means that payment was to be made soon after the latest, soon after the 20,000 vaccines were delivered. So on what basis could the minister go to Parliament to say that nothing has been paid? Is Al Maktoum Father Christmas? Is Al Maktoum Father Christmas that he'll give you vaccines, 20,000, and not receive payment? So you see that this thing that he hasn't paid, that's why I believe we have to press the issue of perjury very hard, because Agmamenu is not living, and so we have to make the law bite. And in this direction, I'm thinking that I want citizens to join me so that we will present a joint petition to Parliament so that he'll be tried for the perjury in Parliament, okay? Because under the Constitution, if somebody obstructs justice in Parliament, he has to face the law.
And the latest to call for the resignation of the health minister is Occupy Ghana. In the last few hours, they've released a statement, and I'll read excerpts of that statement to you. It says, "It is clear to us from the above that the health minister entered into an international business transaction and paid or supervised the payment of monies under the transaction without parliamentary approval, without cabinet approval, without procurement authorities' approval or ratification, and without the endorsement advice of the Attorney General. We do not think that the emergency situation created by the pandemic and the urgency required constituted sufficient reasons to bypass all of these steps that are required by law. As Parliament has indicated, it would have acted with the speed and urgency that the emergency required had the request for the approval been made to it." We further struck that although payment was made under the transaction, the minister said he did not know about it as at when he testified before Parliament. Contrary to this claim, the health minister was copied in the letter from the 31st March 2021 from Acting Comptroller and Accountant General to the Bank of Ghana, requesting the Bank of Ghana to make the advance payment to Al Maktoum from the Health Ministry's account. It is unbelievable that at each of these stages of payment requests, the accompanying supporting documents did not include the approvals mentioned above. It is on the basis of the foregoing that we demand that the health minister resigns from office, even if he meant well under emergency circumstances. Those did not justify bypassing our constitutional and statutory processes. If the health minister does not resign of his own accord, then we call on the president to relieve him of his post. While calling for his resignation, we also believe that Ghanaians ought to be told which other officials were involved in processing and paying the monies without demanding and seeing the requisite approvals. Those officials ought to be similarly sanctioned. Also, Ghanaians should be told when we expect to receive a full refund of the outstanding amount from the recipient. Further, this incident and several others before it bring again into sharp focus the refusal, neglect, or failure of Parliament to enact the law that will clarify Article 181, Clause 5, as demanded by the Constitution itself. Article 1815 of the Constitution applies its loan approval procedures involving parliamentary approval to international business and economic transactions in the following terms. This article shall, with the necessary modifications by Parliament, apply to an international business or economic transaction to which the government is a party as it applies to a loan. And clearly, although the framers of the Constitution wanted such transactions to be parliamentary, to have parliamentary oversight, they anticipated that some modifications will be necessarily required to make them opposite, and therefore empowered Parliament to take legislative action in that regard. And that's based on the accident of litigation. The Supreme Court has compared not only to interpret Article 1815, but to make rules governing its application. And so this is the statement that was issued by Occupy Ghana. It goes on to say, we therefore call upon Parliament to, as a matter of urgency, draft, consider and pass the required legislation that will give to Article 1815 the clarity anticipated by the framers of the Constitution, demanded by the Supreme Court and prayed for by the Executive through the Attorney General, and it's issued by Occupy Ghana. Now, in a related development, the vice chair of the parliamentary committee that probed the Sputnik V vaccine deal, Kwabena Mintakando, says even though the censure motion was deferred by the speaker, he will continue to pursue the matter until the over 16 million cedis paid is refunded to the state.
When we're debating the report on the floor of the House, our leaders sought to amend the motion to include censorship. The question has been deferred. Probably will continue when we resume. But the point is that I'm going to follow up with a parliamentary question to make sure that we have evidence to the effect that the money has really been refunded to the state and other issues. So we will. It's unfortunately, that is my job. I'm the ranking member on the committee. Yeah. So yes, whether you like it or you don't like it, I must also live up to expectation. So we will do our best.
Procurement analyst Kwabena Tabedo believes that apart from the health minister, the finance minister, and all civil servants who were involved in the deal would have to be questioned.
Technical people behind them who know their job, who should be advising them on the bureaucracy and how to handle it. Where are those people? Those people should be responsible. Actually, they should be whipped in this, not the ministers. The ministers will take ultimate responsibility, but there were technical people, and these are the people who are not doing Ghana any good.
So,
now, as to being able to retrieve the money, yes, we've paid money. It hasn't been supplied. It is part of the processes. If you are pulling out out of a contract, once termination triggers, there are actions that follow with termination. Part of it is recovering all assets from the other part. Our money is part of the assets, and we should be able to recover it. But you see, it depends on how the contract was structured. And I have seen a number of government contracts with third parties, which are very weak.
Okay, what are your fears? Is it the case that, or are you worried we probably may not get the money back because of the way we structured the contract?
We may end up chasing rabbits through their holes, and it will not come back unless we are ready to go through the international courts to pursue and collect it, which we must.
Away from the COVID issues, there appears to be a looming labor unrest as various worker groups threaten strikes over salary disparities and what they describe as unfair conditions of service. The University Teachers Association, the Ghana Medical Association, and other worker groups say they are becoming increasingly frustrated with government's failure to adhere to agreements signed on the salary increments. Let's go to let's speak with UTAG. Its president, Professor Charles Mafo, has joined shortly. Professor Mafo, I'm grateful for your time on the Pulse. What did you resolve at your meeting that just ended?
Well, we had a meeting with the lawyers to advise us as the way forward. And then apparently the advice is that we can also go to the court because government has served an injunction on us, an interrogatory injunction. And we are also seeking to set it aside.
Well, I hope you know the ramifications of setting this aside. Why do you want to set it aside?
Because we think that the interrogatory injunction is not right. That's all. That's what our lawyers advise us.
But you've been meeting with government. I remember last week you were in a crunch meeting with government. What was the outcome of that meeting?
Nothing substantial was reached, and that is why government itself says there was a stalemate. So if nothing was reached, I mean, I guess that is why they've sent us that interrogatory injunction. And so we are just following suit. I mean,
what exactly was your position and government's position, the reason why you could not reach consensus?
Well, we have put forward our condition of service issues. Government thinks it cannot meet our demand, they are making proposals. That is why we have certain. They make proposals, we make proposals. We could not come to agreement, and the meeting ended.
Prof. Mafo, I'll have you hold for me a minute because I have Deputy Minister for Labour Relations, Bright Rekubrobe, who joins us shortly. Honourable, I'm grateful for your time. Now, the National Labour Commission is headed back to court to cite the UTAG for contempt or for breaching for refusing to go back to the classroom in spite of injunction placed on their industrial action. Now, how do you react to this? All right, so before we hear from the minister, let's listen to the National Labour Commission's General Secretary, Ofusu Asamoah, who says the lecturer's response to the court order is a clear violation.
If the court has spoken and the party decides to defy the orders of the court, the best thing is to take the person to court.
So you are taking UTAG to court?
Yes, we have to go back if they defy the court order.
When will this be?
That should be tomorrow.
Okay. What are you going to seek from the court?
We are going to seek compliance and punitive action for defying the court order.
What kind of punitive action would you be asking for?
We will be citing them for contempt. So if the court finds them guilty of contempt, then the court will apply the punishment at once.
So is your expectation that, for instance, Professor Mafo, president of UTAG, would be jailed?
Oh, no, I don't expect him to be jailed. We have to purge his contempt.
Because I was simply asking that because it's part of the spectrum of sanctions.
Part of it, but it's for the court to decide. But I don't wish him like that. I mean, Ghana prisons are not good. I mean, that's it.
So, Prof. Mafo, you heard Ms. Ofusu Asamoah there talking about going to court to compel you to go back to the classroom. What do you say to this?
I think they've done that already with the interrogatory injunction, and that is why I told you we have also asked our lawyers to follow suit. I mean, the lawyers advise that we also go to court. I mean, that is why we are at court. I mean, once they file our position that the judgment should be set aside, I guess there will be no case. But if that is not the case, I mean, I'm sure they will advise us exactly what to do.
Prof. Mafo, how long do you intend to continue with this strike?
Indefinitely.
All right, so hold on for me. Mr. Bright Rekubrobe thankfully has joined us. Mr. Rekubrobe, last week you were in a meeting and you assured us that government will do everything to resolve this. Why are we here?
Aisha, good afternoon, and good afternoon to your listeners. Your question is interesting. I would even also ask, why are we here? You know, like I always say, labor and government or the employer are more or less akin to matrimonial couples. It worries me a lot when we have to be in the public domain and, you know, arguing like this and talking like this and even how far we have to come. There's opportunity for us to still talk. All government is saying is that let us call off the strike. Let's not use the students as bargaining chips. Let's allow them to go through what they are going through and then write their exam in the face of COVID. Parents are anxious. The government itself is anxious. I know most of these lecturers are not happy with what is going on. So why can't we come back to the negotiating table and talk? Why can't we come back? We are ready. If they want to meet us tonight, we are ready. Then we meet and talk about the issues. In any case, if this strike should persist for God knows how long, we will still get back to the table and talk. With all due respect, my learned professors and lecturers, let us see that ultimately our children in these schools are all we have. They are human resources, and they are training them. If we take even about a month or two resolving the issue, Government will always go back if we agree, even pay arrears. So why are we here, Aisha? Why are we here?
Mr. Brobe, last week's meeting was supposed to resolve this matter once and for all. What is government's position that is actually irritating the teachers that they are refusing to go back to the classroom?
What I hear now is that our lecturers are saying that the fact that government has even gone to National Labour Commission is what is irritating them. That not to suffice. They are also saying that we need to look at their salary readjustment and restore them. And that government's position is that is a no-go area because all of us are public workers and we all are on the single spine. So we cannot single them out at this point when we have had base pay negotiations done by public services joint. And so we are appealing to them that let us rather look at their conditions of service, which we have largely looked at, but for one or two. We are now on the table basically looking at research allowance, which is more peculiar to our lecturers. Government is ready now for us to sit and talk. That is where we are, Aisha.
Now, Professor Mafo, the minister, you heard him right there. He says that government's doors are still open and that you can go back to the table. Are you willing to do that?
Oh, yes, our doors are also open. We are still, if they call us tonight, we will come.
Mr. Rekubrobe, have you reached out to UTAG to come back onto the table, like you say?
Aisha, as per the dictates of the law, you know, once we begin to talk, it means that there's no stalemate. And therefore, the other party must not be on strike. That's what we are saying. Just call off your strike and come and let's talk. Like I said, if it should take us 3 weeks, 1 month, and so, if it's even 2 months, government has done it before. We always go back and pay whatever you are due by way of arrears. So just call off your strike. Let the anxieties on campuses reduce. You may get people taking advantage of this and going and coming home in the face of this COVID. It doesn't help anybody. Parents are worried. So I'm appealing to our lecturers. I'm appealing to them. Let's put humanity first. It is not as if there is nothing on the table. We are talking. Whatever it is, we are talking. So I'm appealing. I'm using your medium to appeal to them that indeed, if they are listening to me now, through the president, through my minister, through the minister for finance, through all those people who matter, we are appealing to them to let's come back and negotiate.
Mr. Rekubrobe, what exactly are you offering them? Because they've made a demand. Have you met them halfway? What exactly have you offered them that they are refusing?
Well, that is a boardroom discussion with them. It's about their research allowance, and we are looking at a roadmap. So both of us know where we are. For now, if they have agreed that we should be talking, then we are on the same thing. We are just listening to them tonight, that they will ask their students that they should go back and do their work. And then whilst they come for us to continue the negotiation, that is all.
Professor Mafo, is this something that you are considering?
As I told you, if they invite us tonight, we will be there.
Would you ask your members to call off the strike so you go back to the table?
Members will call off the strike when the right things are done. You see, as we speak, the last time, Honorable Brugge has spoken so well, and somebody I admire, so sometimes I don't even want to debate him, but the whole point is this. The last time we met, we were told clearly that we are in a stalemate, so nothing is on the table. We said what is even on the table has been withdrawn. Am I lying? It's true. And so now if we say there's an opportunity for us to get back, we are also ready to come. But just as they want us to call off the strike, why are they in court? As a sign of good faith, maybe they should have also not gone to court and said, or why did you go into court and said that now that earlier on you said it was withdrawn, anything. There is no more offer on the table. Now, if it is not that case, then we should also not go to court and call us back to the table.
Okay, so you want a withdrawal of the issue from court, then you can go back to the table.
I think so, because otherwise, how do we go back to the table?
But if you say the right thing should be done, what, in your opinion, are the right things?
That is what I said. You can't come into the table when you are also in court, just as they don't want us to be on strike.
Aisha, with all due respect, I am throwing a gesture at Professor Mafu. He should meet me tomorrow morning. We go to Labour Commission. The two of us are the people in court. He should meet me. Let's go there. Let's appeal to them, withdraw the case, and you also cause off the strike. Then we sit to negotiate.
Deal?
I'm ready to do this 9 a.m. tomorrow.
Professor Mafu, deal?
I think that is why I said this minister is one of the most realistic guys I've ever met. And for him alone, I could say this. But he knows where I am. And I'm right. If these people have spoken this to us, maybe we wouldn't be where we are today.
Okay.
So for me, it's a welcoming news for him to have said that. I'll put it on before my people immediately. Because we just had the meeting and we've never had things like this.
Okay. So 9 a.m. tomorrow morning, we should expect a meeting.
He knows I'm in Kumasi, so maybe he's just saying that it is possible. But he knows I'm in Kumasi.
Okay, so Mr. Rekubrobe, 9 a.m. tomorrow morning, he should come to Accra.
I am in Accra, so I'll wait for him. In the meantime, I will show gratitude to Professor Mafu and team. And I am still appealing to them. Tomorrow, I'll be waiting for him. I'll avoid all engagement and wait for him. Anytime he reaches Accra, I'll go with him to Labour Commission and ensure we all do the needful. While I will appeal to Labour Commission and withdraw the case, then he also will ensure that the strike is called off. So we can get back to the table.
So, Professor Mafu, now that we have a deal, would you ask your members to go back to the classroom?
Members immediately. Because, as I've told you, the few times you have gone to government, he and his boss have been the only solace we have had. And he knows that.
Okay. So you go to your members and speak to them and decide whether they would want to go back to the classroom or not.
I will do that immediately.
Okay, so what exactly are you going to do? Are you going to ask them to go back to the classroom?
I think you heard what the Honorable Minister said. That is exactly what I'm going to put.
That you're going to meet him tomorrow morning, but you are not going to call off the strike yet.
Aisha, you are pushing this. I have to tell them. I'm sure if they know this kind of exhibition of good faith being exhibited by this Honorable Minister, definitely they will also have that sense of coming to the table, and we do the right thing.
I'm grateful for your time, Professor Mafu.
So Aisha, let me also put on record that right from your discussion, I'm going to meet with my ministers and appeal to them that I have put this offer on the table and that tomorrow I'm expecting Prof. Mafu and team to come. We'll go with them to Labour Commission, arrest whatever engagement they want to have with us so that they also call off their strike, and then we continue to engage.
Right. Having settled that, UTAG isn't the only group on strike. We have Ghana National Association of Teachers. We have GMA also threatening strike. At the moment, the Senior Staff Association is also on strike. What has become of the issues tabled by these unions, Mr. Brobe?
The Senior Staff Association, as we speak, they assured me firmly after Thursday's engagement at Labour Commission that they were going to meet. You know, the rules of engagement for union are that once we go to Labour Commission, whatever the ruling is, they need to get to their neck and then take a decision. So they assured me, based on the good faith that we displayed at the Labour Commission, they assured me that they will call off their strike after their neck meeting, and I am sure that today they are back to work. You may cross-check and find, but they assured me that they'll go back to work. On the matter, on the substantive issue, we also dealt with on Wednesday. We are meeting on their substantive matter, and then we are given 1 month by Labour Commission to resolve it. So, in good faith, the two of us have resolved to work together towards an amicable solution. That is the issue with SSA. For Ghana Medical Association, we are grateful to them for giving us a roadmap. You know, we have brokered their conditions of service with them, except the implementation. They have prompted government through their press release that some of their conditions of service are not being implemented. So it's a wake-up call. My minister discussed with me this morning. We are taking it up seriously. Look at areas where it's not been ironed out, and then ensure that implementation is done before even they get to their roadmap where services will be withdrawn. We don't want to get to that stage. So that is what will happen.
Mr. Rekobrebe, I believe you agree with me that this is a situation we don't want to hold on for long, especially with Ghana Medical Association threatening to go on strike in October. And I want to ask a question. Is there crisis on the labor front?
At all. Aisha, I wouldn't call that crisis at all. They are only sounding caution that they have brokered something with government. And they have been looking at how far we are implementing. They find the implementation pace quite slow. And they want the government to ensure speedy implementation. And that is exactly what we are going to do. So the roadmap that they have given, we will get there. This is not a matter of crisis on the labor front. I beg, please withdraw that word. It is not at all.
Do you want to give timelines as to when you would resolve each and every one of the union's demands that they've tabled before you?
I am unable to do that on the spur of the moment, but there are matters on our table that we are looking at. So, by all means, we will make sure we have the peace that we have enjoyed on the labor front continue to exist.
And you can assure us that the Ghana Medical Association won't go on strike even in the midst of COVID-19?
God willing, Ghanaians will experience peace on the industrial front.
Right, Rekobrebe is the Labour and Employment Deputy Minister for Labour and Employment Ministry. I'm grateful for your time. Here's a news desk report we have put together on the agitation on the labour front.
Activities at the country's public universities have come to a halt over the last few days after the University Teachers Association and the Senior Staff Association decided to withdraw their services. UTAG declared a nationwide strike from August 2, accusing government of delay in the negotiations of their conditions of service. They're demanding government reviews the current rate of research allowance payable in 2012, among others. Dr. Eric Abavare is National Secretary of UTAG.
Those agreements were just the peripheral. The peripheral here means that there were issues to partially address, do not constitute the core of our concern. And the core of our concern got to do with the restoration of our emolument or our salary.
Newly elected General Secretary of the University of Ghana branch of UTAG, Professor Ransford Jampo, says they will continue with their strike in spite of a court injunction restraining them.
The fight has just started. Lecturers on the various campuses have voted to continue with their strike action. So what would they do to these lecturers? Arrest all of them to prison? Well, let us see. Let them come arrest all of us and send us to prison. We'll go and demonstrate there.
Health workers are also threatening strike. The Ghana Medical Association has served notice of total withdrawal of services by October 15 if long-standing issues of salary and other conditions of service are not met. Dr. Justice Yankson is General Secretary of the GMA.
We have done more than enough in terms of what we have to discharge by way of our work. The onus is now on the employer to also ensure that they meet in full their side of the bargain.
There's also tension brewing amongst members of the Ghana National Association of Teachers, which has rejected the recent 4% salary increment for public sector workers. Several other unions, including the Trades Union Congress, had earlier rejected same and demanded a review to reflect the growing income gap between Article 71 office holders and ordinary government workers. Philippa Larson is not president.
The current system of remuneration in the public sector is not fair. It favors some categories of office holders in the public service, and we are not going to agree.
Meanwhile, the Director of Labour Research and Policy with the Trades Union Congress, Dr. Kwabna Nyako Otu, says the union is under pressure from its members to call a strike in protest against the 4% salary adjustment for public sector workers.
We also have the issue of pay inequity in the public service. Now, we need a presidential commission on wages and salaries.
We're still live on the pulse. Still to come in our analysis, the Ghana Registered Nurses and Midwifery Association has called on the government to, as a matter of urgency, hold the reintroduction of the community health workers, and we'll bring you excerpts of those statements issued by the association on the pulse shortly after this break. Welcome back to the pulse, to the rest of our stories. And the Ghana Registered Nurses and Midwives Association has called on government to, as a matter of urgency, hold the reintroduction of the community health workers, Zoom nurses. This comes after the association's attention was drawn to a memorandum of understanding signed between the Ghana Health Service and the Youth Employment Agency, YEA, for the reintroduction of the modular 6-month training of community health workers. We'll hear from them shortly, but last week the Youth Employment Agency, in collaboration with the Ghana Health Service, announced a 1 million jobs initiative beginning the Community Health Worker Group program. According to Deputy CEO of the YEA, Alhaji Ibrahim Bashir, the initiative is part of efforts to augment the fight against COVID-19 in Ghana. Now, Ghana will provide quality healthcare delivery services, especially to rural communities, with this YEA agreement that has been signed.
Couldn't have had a better time to do this than an era where the whole country is bedeviled with this pandemic and this monster called COVID. And so it is the hope of the Youth Employment Agency and, of course, the Ghana Health Service that these young people will help in the fight against COVID. Like the Corporate Affairs Director intimated, if you check our rural communities today, it does appear there's people who still believe that there's nothing called COVID. And I believe the only way we can get people to believe that there's COVID and for us to actually respect the protocols, we'll have to do a lot of education. We need to educate people. I recall somebody was interviewed on TV, and he said that he wants to see COVID with his naked eye. And his estimation is something that is visible. And I think that if we get these young people to the rural communities, our KIPS compounds, our health facilities, our clinics, the polyclinics, it will augment the staff strength of the Ghana Health Service so that together as partners in development will make something very meaningful. I want to also add that the Youth Employment Agency is particularly excited that today we are going to sign an MOU that will lead to the creation of about 3,000 jobs. First of all, the purpose is to create jobs, and secondly, is to help in the fight against COVID, and also to help our health facilities that are under pressure now.
Now, Director of the Ghana Health Service, Dr. Patrick Kumabo-Adjei, who signed a memorandum of understanding with officials of the YEA, explained beneficiaries of this initiative who prove themselves worthy will eventually be absorbed into the Ghana Health Service.
The team will be doing, among other things, education. They'll be providing information on rumors, outbreaks of diseases, and many other things, including sometimes distribution of certain essential basic commodities that the community needs for improved health. We've gone down this road before, and we saw that when we had put them in the region, particularly Ashanti region, We saw the results that we got in the region in the years that we had the youth employment team there working with the hospitals and the CHIPS levels. We know that this is going to be deployed to most of our most sensitive and deprived areas where we can reach people. It also come at a time where we need to improve our risk communication to get people to change their behavior in their response and adherence to the protocol that have been designed to mitigate the effects of COVID. We will also do our best to build the capacity of these community health workers so that they can move on to the next level. And for those who are able to make it and to join our health sector, we are ready to not just waste the capacity and the resource we are wasting in them, but also become part of our team to improve, continue to render services, health services in the country.
But the Ghana Registered Nurses and Midwifery Association is unhappy about these plans. Joining me on Zoom is David Tinkran Chum. He's General Secretary of the Ghana Registered Nurses and Midwifery Association. He wants government to immediately halt the program. David, I'm grateful that you joined us. So what are your reasons for asking government to halt the program?
Hi, my brother. Mr. Free, right? And your viewers and listeners as well. Yeah, I think that Youth Employment Agency have every right to maybe support government in creating jobs for the youth of this country. But we have walked this path before, and we clearly understand the processes. I don't know whether Mr. Free was working with Youth Employment Agency as far back as 2006 when that first model was implemented. I think that in their initial MOU, they were very categorical in the usage of the word community health nurses. I personally, when I read it, I realized that they got it wrong. And I think they have to apologize for the wrong usage of that nomenclature. But be that as it may, what we are trying to say is that these community health workers will end up in a hospital anyway. And besides, they quoted copious ILO conventions and the rest of it. I see a very shallow and pedestrian interpretation of some of these interpretations that is given, because it is country specific. It is country specific because countries that have problems with healthcare in terms of human resource is where you deploy these community health nurses. And that is what the article stipulates, all right? Not when we have trained, highly skilled nurses and midwives unemployed, then you want to deploy community health nurses. The Director General was saying something that, they will help in education and whatever, or even the Chief Executive Officer. Where were these community health workers when we were fighting the first and second wave of COVID-19, that nurses and other healthcare workers died? All right. What makes you think that somebody who has been trained for 6 months or 4 months can educate the good people of this country better than a professionally trained nurse or midwife? So for us, as far as we are concerned, the reasons that they are used is simply a non-starter. And if they like, they can go ahead. You understand? They have the mandate of the people of this country. They can go ahead and do whatever they want to do. But we are working in the various communities. We are delivering services at the various hospitals, and we think that they will not, or these people will not inure to the benefits of our members. Let me tell you something. I have worked with them for more than 20 years. I'm telling you that sometimes because they are less remunerated, because they are not properly remunerated, they get so frustrated on their job and they vent their spleen on patients and relatives. And you see, anybody who misconducts himself at the hospital, especially if he's a female, they say that the person is a nurse. And these are the issues that we are talking about here. We want quality of care for the ordinary Ghanaian. Okay, so if you have professionals who can run our hospitals and give precise and equitable healthcare, why go for somebody who is half-baked? Okay, look, life is extremely important.
So those people
is extremely important.
So those people are not qualified enough to do the job. That's what you're saying.
I'm telling you that life is extremely important, and the leadership of this country must attach some importance to the life of the people of this country. All right? Because you see, life is only one, and when you lose it, you lose it. All right, so please, we need to be extremely careful. When Barbados was signing an MOU with with the government of Ghana, what did they say? They wanted degree and specialist nurses and midwives. Barbados. You see, why do we go back? What I want some of these chief executives of the various agencies to understand is that, yes, we agree that they are doing their best. I mean, they need to help the government to create jobs. But please give proper, sustainable, and dignifying jobs. Not these kind of jobs that is not going to help. No, they can deploy them at various centers. I mean, we have beaches. I mean, there are several beds at the beaches. I mean, there are several things that debris that the sea pour out on daily basis at the beach. They can go and sweep there. But look, let us attach some importance to the life of the people of this country.
Thankfully, Kwesi Afriyie, who is Director of Corporate Affairs at the Youth Employment Agency, has joined us. I'm grateful for your time, Mr. Afriyie. First of all, what motivated this kind of signing up of this agreement? Mr. Afriyie, kindly unmute for me.
Right, is it okay now?
Great, loud and clear.
Right, so thank you very much. Let me extend my heartfelt greetings to my brother, David. I've been listening to him, and to answer your question, it's out of need that we are embarking on this project. Basically, it's out of need that we're embarking on this project. If you read our statement, we have outlined a number of issues, particularly including that of COVID. And we have stated clearly that these people are not and cannot be equated to nurses or doctors or even physician assistants. These are people that are going to help in the very rural communities in preventive healthcare. So we are not, as they have stated, adulterating what they are doing. We are not setting people out to be in competition with the nurses. We are not displacing their profession. And so there is no cause for alarm at all. There is no cause for fear and panic at all. And he talks about professionals. He talks about the fact that Ghanaians deserve better. That is why we are doing this, because you go into the very rural communities and you don't have, most of these are doctors who are professionally trained. Most of these are nurses who are professionally trained, even from the areas where they themselves come from. The only way we can help as a youth employment agency is having identified the challenge, having identified the gap. What we're able to do is to try and bridge the gap, not to have a competition of both setups or both the nurses or the doctors or the physician assistants. We are supporting, I mean, there have been times, in times past, before these ambulances came, where you heard a lot of stories where in a community or a chief's compound or a community which doesn't have a hospital or a clinic or any setup at all, they have to put somebody at the back of a motor and ride the person to the district hospital or wherever they find a clinic before they find a nurse or they find a health to attend to the person. Somebody who is who needs maybe paracetamol, somebody who needs primary health care before the nurse who is a professional comes in. This is what we are doing. There are sometimes they need training on sanitation. There are sometimes they need training on how to keep themselves and prevent certain kinds of diseases. When cholera breaks out, you don't need doctors who are highly trained, who are supposed to be seated behind their desks, and nurses like my brother David, attending to patients, to also be going out around doing some of these things. Of course, it's their work. But what we're able to do is to train these young people, and mind you, these are young people who have completed most of the times senior high schools, or sometimes even tertiary institutions, and are aiming to become health professionals. So they already have the passion, they already have the interest.
All right, so Mr. Afriyie is trying to explain, and of course he earlier made the point that there's a clear miscommunication somewhere. So when we get him back, he will try to clarify for us what exactly these people are being trained to do. But Mr. Tinkran, he says they are not coming to compete with you. They agree that these people are half-baked. Some are from secondary school, so there's no way they are going to compete with you.
they can't even dare compete with us. So what I'm trying to say is that they are going to misrepresent the profession. All right, and we need to understand some of these things. Look, Mr. Free, when you fall sick, I'll get some of these community health workers to take care of you. You understand the challenges that I'm trying to lay out here. We need highly skilled people to take care of the good people of this country. That's all what we are saying. We want highly qualified personnel to take care of the good people of this country, irrespective of wherever the person finds himself. You made mention of chip centers and the rest of them. I mean, chip centers are manned by trained, highly skilled
I agree.
and the rest of them. So please, I'm saying that, look, you can deploy them to other centers because they hold themselves as such. I have worked with some, and I'm telling you, for the past 20 years, they hold themselves as such. You will not train and tell them that go and hold yourself like a nurse or something. Look, so many things goes on. They extort money. Look, I don't want to mention it, but I have worked in Koforidua Regional for a very long time. These people, because they are not well remunerated, they sometimes extort money from patients, and it creates a whole lot of mess in the system.
David, you agree?
David.
Please, can you? I'll not hold you for my people.
Okay, David, let him.
That you mentioned.
Okay, Mr.
Right.
Freer, make
some
your
of these
point.
Challenges that you mentioned. Right. So I am saying that I agree. I'm not holding brief for my people, but you also agree that some of these challenges that you mentioned it runs through even for the physicians, even for the doctors themselves, even for you, the nurses. There are some of these problems. But what we are saying is that they are not in any way equated to you. What we are doing is a stopgap measure. You look at the Ghana Police Service, for example. We have an agreement with the Ghana Police Service. We know that the recruits we are training are only going to assist in the delivery of security in our country. And you see the community protection assistants, as we call them. Of course, we have stated in our statement that there is going to be the twist of the names, there is going to be a misrepresentation, misunderstanding.
Mr. Free, what exactly are they going to be doing?
Thank you.
So we have stated clearly, and if you permit me, I want to quote the ILO, as we quoted in the statement that we brought out. We said the ILO refers to community health workers as a distinct occupational group and within the associate services and provide support. So apart from what we are doing, I'm telling you what the internationally recognized labor organization has agreed or has stipulated for every other country that is recruiting community health workers. So they have stated that they are going to provide support and assistance to communities, families, and individuals within preventive health measures and gaining access to appropriate curative health and social services. This is all they are going to do. And if you look at almost all our modules, our beneficiaries are largely on intention. They are interns. So I stated to you that most of them have completed SS. They are yet to better their certificates and get into the health profession, or for example, the security profession if they are community protection assistants. What we are expecting David and his team to do is to help train them, help let them understand how the practice is, so that when they're able to better their certificates and they come back to school, they will be able to run through as quickly as possible, become a professional like David, my brother, and be able to deliver the quality health service that he's expecting the community health service to deliver to the people of Ghana. Of course, we are not saying that they are going to take care when you need a paracetamol, when you need an antibiotic, they are going to prescribe that for you. No, they cannot, and they are not supposed to. We have not stated that. We are very clear in our mind that that is not their mandate. We are not sending them out to be doing that. So my brother David should not panic at all.
So has the Ghana Registered Nurses and Midwives Association been part of this all this while?
Of course, they work with them, with the Ghana Medical Association. I mean, all of these come under the Ghana Health Services. So for us to go to the point of signing an MOU, not just with any mean person or institution, but with the Director General of the Ghana Health Service, who has been at the forefront of this COVID prevention. In fact, when we brought this up, he was very happy. And his whole team were very happy that, I mean, there is a need to expand every effort that will mitigate the impact of COVID. You are in the country, you are a reporter, you have been following this. have been praising the health professionals and how the country is supposed to contribute
let him land, please.
in mitigating COVID. So we have met with Dr. Patrick Kumar-Boadjeh. We have gone through the processes. We have engaged, and we are still engaging. In fact, we will engage with my brother David as well. And we have signed an MOU with Dr. Patrick Kumar-Boadjeh and the Ghana Health Service, not Dr. alone, under the auspices of the Ministry of Health. So, I mean, this is a forward-looking and a forward-thinking program that we are hoping to support health delivery in Ghana. I have read to you, assisting and supporting communities, families and individuals within preventive health measures and gaining access to appropriate curative health and health services.
Mr. Tinkran, you've heard him explain this. Have you not been aware of this all this while?
I'm surprised you think this is a brilliant innovation. As far as I'm concerned, it's not an innovation at all. Can you permit me, indulge me?
Yes, sir. Yes, sir. Please go ahead.
You see, and I'm happy you said it is country specific. You see, when the ILO says that train community health workers to augment the workforce or the health sector workforce or to help in the health continuum, they are talking about areas that they have deficient of supply of healthcare workers. As I speak to you, we have 20,000 nurses and midwives who are unemployed. And you are saying you are going to train and deploy. That amount of money you are going to use to train these 3,000 people and deploy them. Use that to employ these knock and nap people who are home, employ the degree nurses, employ community health nurses. What I'm trying to tell you is that we have fought first wave of COVID without community health workers. We fought second wave of COVID without community health workers. What makes you think? What makes anybody, Director General, whoever, thinks that it is community health nurses, community health workers that have the answer to the fight against COVID? They are going to use them as sacrificial lambs.
Is this a
most of when they are not well trained, they are going to be a risk to themselves and to society. That's what I want to tell you.
Is this a concern you've raised with the Ghana Health Service?
Well, we will do that. We issued a press statement. We believe that the Director General has read it, but we're going to speak to all stakeholders. We are not going to work with them. They can decide to train them. We are not going to be part of the training of those people. They can train them. They can use MVTI to train them as they've been doing all the time. But we are not going to work with them. That's what I want to say. So if they can deploy them for them to work on their own, they can go ahead and do that. And who will be responsible? Who is going to regulate them? Who will be responsible for their excesses? If something happens, who will be held responsible? You see, we have to live in a well-regulated system. Nobody can just come and work on patients because there's lack of nurses or midwives. I'm saying that we have avalanche of nurses and midwives who are unemployed. Let us employ them and stop this thing.
So, Mr. Free, are you worried that they are not willing to work with these people you are bringing to offer support?
I mean, we are not worried at all. I think what we need to do is to continue the engagement. We are not worried at all. My brother David is a professional, so we very much respect the profession. And it will be difficult to work without them because, as I've stated early on, it is not just about working with them, but also supporting them, training them, giving them a helping hand. And I've stated clearly
we don't need that support. I'm saying that we have enough people who are unemployed, employ them.
I think that's an entrenched position. That's my brother. That's an entrenched position. But what we are saying is that they are not supposed to treat patients. That's not their job. In fact, if you are in the I don't want to give very technical examples, but if you are in the surgical ward, for instance, or they are not even supposed to go to the operation room. If you are in the hospital, for instance, and a nurse, you need some form of assistance. Bring me a scissors. Bring me a tip. Bring me this. Bring me that. If you're asking a community health worker to do, there are hospitals who recruit people who have no knowledge at all to be doing some of these things. And I can cite one or two, private examples to you. But if we train these people for 3 months, and they already have the orientation and passion for health delivery, and they come to support my brother David, I think it's in order. It is only entrenched on my brother's part to say that they are not ready to work with them, but we will continue engaging my brother and his team, and we are very sure and very hopeful that they will be part of this course. And in fact, I have kept referring to the notes. He was talking about the country-specific program. I would say that this is for the whole of Africa. and the whole of the African heads of states at their 29th summit in July 2017 adopted the resolution of the assembly. And in fact, we gave references to all of this in our press release. And they said, recruit 2 million community health workers. They were very specific to assist in the delivery of all the things that I've stated early on. So it is a need that not only the Youth Employment Agency has recognized, not only the Ghana Health Service has recognized, but the whole of the African heads of states, including our president. This was in 2017, including all other presidents here in Ghana, including World Health Organization, including everybody that matters in health. So, in fact, their position is very, very much critical to health delivery, not only in Ghana, but in all other parts of Africa. And there's a document to this, which we have been giving you references to. But I think what our brother is saying is that in as much as we would want to do this, there should be a space to recruit the remaining nurses who are not recruited. So the issue for me is not necessarily about whether community health workers are important or not. Of course, they obviously are very important. But in as much as we do that, my brother wants us to continue to recruit. And that's not the mandate of the Youth Employment Agency. We stated that clearly in our statement. But it is also very important that government takes a look at recruiting every health worker who has qualified professionally into the system. That doesn't displace the recruitment of community health workers. That doesn't displace the importance of community health workers.
All right, so Mr. Free made his point clear that we're having challenges with his internet. But Mr. Tenkran, so how do you intend to deal with this matter with the Ghana Health Service that signed this memorandum of understanding? And I'd like you to also update me on how far you've gone with addressing the issue of unemployment for the almost 20,000 nurses you talk about who are sitting at home.
Of course, we are in constant touch with the Director of Human Resource. I must say that he's doing a very fantastic job. Director of Human Resource of Ghana Health Service, Ministry of Health. They are doing fantastically well. He's trying to help us to be able to secure financial clearance from Ministry of Finance for our people. What Mr. Free is saying, he doesn't seem to understand me. When you attend Africa Health Summit or whatever, and they ask you to employ 2 million community health workers, when you have qualified people there, qualified health workers, you don't. Where are they drawing their budgets from? Where are they drawing their budgets from? Is it not coming from the consolidated fund? So is it a different budget they are using to pay the people? So you see, I'm saying that it is country specific. So if that you don't have that challenge in your country, you don't adopt it. All right. The fact that you have signed to it doesn't mean that compulsorily you have to implement it, because you have several nurses and midwives who are unemployed. Employ them. Okay, so yes, Nigeria may sign on to it because they don't have that number of nurses are unemployed. And other countries, look, I was the president of West Africa Health Sector Union, WASUM youth president. And several West African countries have serious shortage of nurses and midwives. We have trained nurses and midwives. We are even exporting some to Barbados. They want more qualified nurses and midwives. And you want to bring community health workers when we have avalanche of nurses and midwives at various categories, those with certificate, those with diploma, those with degree, languishing at home, which is leading to de-learning, okay? Because, you see, nursing and midwifery are skill acquisition program. When you go to school to acquire a skill, it's not theoretical. So when you stay at home for a very long time, you become stale. And what happens is that it leads to de-learning. Employ these people so that they can fill in the gap. Just say that you're going to bring all set of new people who are half-baked, who are going to create more problems.
How do you intend to deal with this challenge? Because it looks like the thing has already been signed with the Ghana Health Service.
Oh, it's not a problem. They can sign it. But when we get to the bridge, we shall cross it. You see, we don't need to create confusion in this country. We need to work in peace. I believe in industrial harmony. If something is working, let it work. Don't compound the problem. I'm saying that if the Director General is saying that it is the community of workers who come and fight COVID, then I can't comprehend that. When we have fought COVID during the first wave and the second wave, and everybody can witness that. What makes you think that these community health workers who can fight COVID? As far as I'm concerned, they are going to be danger to themselves and to society, because half knowledge is dangerous. I'm grateful for your time. David Tinkranchum is General Secretary of the Ghana Registered Nurses and Midwives Association. We're joined also by Kwesi Efriye, who is Director of Corporate Affairs at the Youth Employment Agency. Now, Ashanti records more lives and property lost to fire in first half of 2021. 9 lives and property worth over 15 million cedis have been lost to fires in the Ashanti region in the first half of the year. This is despite a 20.4% decrease in total fire incidents recorded within the same period last year. The fire service is, however, resolved in further reducing fire incidents to protect lives and property. Nana Ojima has more in the following report.
The Ashanti region recorded a drastic reduction in bush burning from 222 to 44 in the period under review. Fires in vehicles and institutions also recorded a marginal decrease. Domestic fires in the first half of this year, however, increased to 270 from last year's figure of 246. PRO for the service in the Ashanti region, DO3, Desmond Aka, explains the firefighting procedure in delivering on its mandate.
Out of the 622 that we have recorded this year, 435 were fires that before we even got to the scene, the public themselves have been able to extinguish. And that is a plus on our side, that even the effort that we have been putting in terms of reaching them with the message according to the fire safety is going down well. Just that some few recalcitrants are not adhering. That is why we are having these challenges, especially in our domestic setting. So with time, I know with a lot more effort, we'll be able to reduce it. We have set a target for ourselves to reduce fire and related incident by 60%. And so far, half year and still counting, we have done significantly 20% and more.
On Sunday, 2nd May this year, a 17-year-old died in the fire that ravaged part of Asafu Bibi slum near Kokobod building in Kumasi. On the 24th of the same month, 3 persons died in a fuel tanker explosion at Onyinanufu in the Ahafo-Ano Southwest District. The driver of the fuel tanker and his assistant, as well as 2-year-old boy living in the community, were burnt to death. Fire swept through some slums, including Dagomba Line, destroying property worth thousands of cedis. DO3 Desmond Aka explains measures to address fatalities and property loss being recorded.
As of June, we had lost about 9, as against the same period last year, 3. So it meaning that this time round, we are losing a lot more lives and a lot more properties to the fires that are occurring. It means that we have to change our strategies in terms of reaching out with our fire educational or safety messages, and for which we are much on course.
Kumasi Metropolis has 7 fire stations, with 2 of the tenders down. Despite logistical constraints, the service is targeting further reduction in fire cases, with focus on prevention and the training of the public in handling of fire. The service on 4 different occasions were threatened and prevented from accessing fire scenes, with the accusation of delays in responding to emergency calls. ACFO Henry Jiwa is pleading with the public to call the service promptly as the service adopts measures to address threats from the public.
We intend to mobilize the assemblymen, the imams, opinion leaders, and all that are involved as the zonal communities to explain our operational procedures to them, for them to also explain same to the community. So we organize a forum for all zonal communities, one after the other, and we'll explain to them. We also intend organizing a fire training and organized fire warden within those communities, so they can even start fighting the fires before we even get there.
Statistics from the Ghana National Fire Service shows over 6.9 million cedis more property was lost to fire in the first half of the year. For Joy News, Nanaya Ojima, Kumasi.
Let's stick with Kumasi and go to our roads because Ashanti Regional Police Command has renewed enforcement on road traffic regulations to deal with increasing road accidents in the region. Statistics show 298 lives were lost to road accidents in the first half of the year, putting the region in the lead of road carnages. Acting Regional Commander DCOP David Ajiman says the police will lead massive enforcement efforts to deal with the increasing number. Nana Ojima once more reports.
Statistics shows 2,135 people were victims of road accidents in the first half of the year in the Ashanti region. Aside the 298 deaths, 676 were seriously injured, with 1,161 of them suffering minor injuries. Commercial vehicles lead the category of vehicles involved in accidents, with 1,589 vehicles, out of which 631 are minibuses. Accidents involving commercial vehicles accounted for 156 deaths, whilst 1,194 injuries sustained. Crashes involving 1,284 private vehicles killed 97 persons and injured 491. Saloon cars were mostly involved in the crashes, with the figure standing at 727. DCOP David Ajiman addressing the press, said motor offences lead crimes recorded by the service in the region.
Indiscipline on our roads is the biggest menace in the region. We lose a life every day to road accidents in this region. Again, a minimum of 13 persons are injured a day. And so if you do the math, it means that for a year, for only road traffic deaths, we are recording close to 400 persons, which is unacceptable. So all motorists in the region are therefore requested to henceforth respect the rules of the roads. Otherwise, they would be arrested and prosecuted.
The number of motorcycle accidents, which have become a common means of transport, have also increased. A total of 697 motorbike accidents were recorded with 104 deaths and 539 injuries. 409 of the motorcycles were motorbikes, with 269 being tricycles. DCOP Ajem again.
If they ride without documentation, if they are underage people, if they are riding without regard to other road users, you arrest them and prosecute them.
For Joy News, Nanaya Ojima, Kumasi.
The Environmental Health Directorate in the Northeast region has recommended that local government assemblies prioritize development in communities that are improving upon their sanitation situation. The Directorate is also calling on the assemblies to gazette its sanitation bylaws and provide adequate financial commitment to assist the fight against poor sanitation, particularly the practice of open defecation. Speaking at a tour of some open defecation-free communities, the Regional Environmental Health Director, Mr. Osman Alabiri, said the recommendations will help his outfit to attain their target of making the entire region open defecation-free in the next 3 years. There's more in the following report.
Takuka is a small community located along the bank of the Nasia River, about 15 kilometers west from the Nasia town, with a population of about 120 Ewe immigrants. The community was entered with WASH intervention under the USAID WASH for Health project in January 2016. By October same year, it became the first community in the area to be declared open defecation free and has since been able to sustain the status since then. On the 13th of July 2021, the community was verified by the Northeast Regional Interagency Committee on Sanitation and declared open defecation free level 3, making it the first community yet to have attained this status in the entire country. Former assemblyman for the community, Abochi A. Prosper, explained to JoyNews how the fight against open defecation began.
So after the triggering, they asked us to draw a map of Tekuka. We drew the map of Tekuka. And in the map, they've asked us to indicate where we defecate. So in the map, if you see how physics is around the community, in fact, we were so ashamed of ourselves. And they asked us, so how do we feel? And we feel bad. So because of that, we say no, we will not eat. We realize that we are eating our own feces. We will not eat our own feces again.
It was observed that households in the community still owed use and properly maintain and improve latrine with tippy-tap, as well as pens where they keep their animals. Speaking at a mini gathering with officials from the Regional Environmental Health Directorate, the former assemblyman also stated the community has since witnessed tremendous benefit following its victory against open defecation.
As I'm talking to Tekuka, has achieved a lot because of this program. Initially, we were sharing water with animals, but because of this program, global community, they provided us with borehole. Initially, if you are coming to Tekuka, in fact, even if you are using a car, if you go back, you have to wash the car to be very dirty. We don't have road, but because of this program, they've constructed us a road. Last 2 weeks, Tekuka is connected to the national grid. We are now having electricity. Initially, our children were falling sick because we were just defecating anyhow. This cholera, but this time I can't remember the last time a child is sick in this community and they go to hospital and a doctor will say, oh, it is diarrhea. No. As you can all see, the community is very quiet, very neat. The environment, the air too is very nice for you to breathe. There's no any pollution in the community.
One of the major measures that helped the community to achieve the enviable sanitation status was the setting up of regulations and sanctions against open defecation. The chief of the community, Kwesite Agbe, thanked the implementers of the project.
300,000. He was talking about initially the bylaws. If you go against the bylaws, you pay 20 cedis, increase to 30 cedis. That now, as we are in the sanitary level, he has increased it to 50 cedis. And he's using this opportunity to thank everybody, his community members, for the support that they give him. For Tekuka name to be global.
The government agenda 111 aiming to construct hospitals in underdeserved districts across the country is finally taking off this month. President Akufo-Addo, who announces as part of his tour of the Bono East region, says the design, site and other logistics have been secured for work to start. Addressing the chiefs of Parang in the region, President Akufo-Addo said COVID-19 has exposed the weaknesses of the country's health sector, but also provided opportunities to fix them.
Sena district hospitals in Ghana, 101 districts, NEB, out of the 260 districts in Womem. Then also and more improved here. The Mami program agenda 111, Approve West come. Eche Busumi Emuno, the Baba Commission 101 district hospitals now agenda 111. Designs, contractors, land has been secured all across the country. And this month we will commission and begin the construction of the Yare by me Husania Menu Kwasi Faso become self-reliant focus in our healthcare. having access to healthcare for everybody. Now, for instance, no vaccine. I know yes, vaccine wa brofo home. We feel say ochire bibiom and say banasa. Say sa nyanse hu a time Ebola no buy anke ABN they buy and between next time we're going to produce vaccines here in Ghana under Ghanaian leadership for our country. And the way say a higher big agricultural area for investment. I have appointed myself Pru West Agriculture Investment Promoter and number.
The Krontihine of more traditional area in the Kintampo North Municipality, Nana Dinkra II, wants President Akufo-Addo to ensure that the road network in Kintampo and surrounding communities are constructed to help bring development to the area. He made this call at a Debar of Chiefs as part of the President's two-day working visit to the Bono East region. There's more in the following report.
The President, Nana Addo Akufo-Addo, commenced his two-day working tour of the Bono East region with a Debar of Chiefs from 3 traditional areas within the Kintampo North Municipality, where the Krontihine of the more traditional area, Nana Dinkra II, lauded the President for the introduction of flagship policies that has impacted positively on the lives of the people.
Nana niawaya amayene doso. Yekase kuya dia na ene Kintampo. Okasa oba. Ontoto kuyayo ejuma asekura.
Nana, you promised to help improve agriculture when voted into office, and you introduced the planting for food and jobs, which the people have benefited from the free fertilizer and seeds policy.
Nana, when you see when you said district biara, kwanya obefaso ema yenya factory.
You also promised one district, one factory to help create jobs. We've had our share, which is the mango juice processing factory at Kintampo Habitat.
Processing factory. It will Habitat Kintampo Kruti here.
He, however, called on the President to ensure that the road network linking the Kintampo Township to other communities in the area are constructed to help bring development to the area.
Nia e kuyen wo Kintampo ya kwan nanan. If you Kintampo ekosi kunsu kwan enye.
Our road networks has been terrible. The road linking Kintampo to Kunsu and a couple of other roads are in deplorable states. So we call on you to counter our aid.
Kintampo ekosi mansra sa akwan nyina atete apansama ewura eye hunwia nana enye yie yebehia omoa.
Nana Dinkra appealed to the President to upgrade the Kintampo Government Hospital into a teaching hospital to help improve healthcare across the region.
College of Health. Health Research
We have a College of Health and Health Research Center. We believe that Kintampo Government Hospital could be upgraded into a teaching hospital to improve healthcare.
Teaching hospital amayen nke ni beji do asibebre.
On his part, the President Nana Addo Akufo-Addo explained the purpose of his visit to the area and thanked Nananum for giving him the nod to rule for 4 more years.
Babe baya no na miema mienu titru. Samoba kaya Moboa mi mame kofro Ghana kuna kese no 2017 no mi shase se afi bia no beba momoden akwa mensi na woni Ghana nyina aduma ekoso mpunto ekoso mama ame hu se ekoni yiu enkonu yiu ekonu papa enkonu bonia mi ame di beni akwa na mame kwanso etie nsema da manfo komaso. In
response to the requests made by the traditional authorities, The president assured the people that the health ministry would take a look at their requests and respond accordingly.
Hospital elevation to teaching hospital. Which means say Wakemaso. As a many health minister. And the finance minister, we do cry. As one with better name, some be bahano, the back in Tampo. And the Sadia Cassia Mother the elevation of the hospital into a properly staffed teaching hospital. Now, what there? By all means, as I say, a BB, as I say, a bomb in the Yahoo. BB every December.
The president ended his visit to the Kintampo North municipality with the commissioning of a court complex in the Kintampo township. Reporting for JoyNews, Anas Sawat, Kintampo.
And that's how we wrap up for The Pulse this afternoon. It's been very exciting start of week with you. Hope to continue that way throughout the week. Many thanks for watching. My name is Aisha Ibrahim. Do enjoy the rest of our program.